Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats, and thank you so much for joining us today. Amber and I are going to talk about a fun topic today that gets a lot of attention, and so we've been kind of trying to figure out, should it be getting all this attention?
Well, I get like ads. You know, like when you think things in your phone, I swear your phone like can read your thoughts.
It does,
And I'll get these, I know we're talking about deliberate cold exposure, but
yes.
it often is referred to as cold plunge. And so I'll get these like, do you want to spend $5,000 on these cold plunge tubs? I'm like, no, I do not, thank you.
Right.
But I get them on my ads all the time, so that's how popular they're becoming.
Yeah, exactly. So we're calling it deliberate cold exposure because that's allowing us to kind of take a broad approach to this. There are different ways that we expose ourselves to cold. The reason we're throwing that extra deliberate word in is because there is a difference in the outcome. If you have put yourself in a, oh my gosh, I may die, I've just fallen into a lake or something like that, that has a totally different response on your body than if you are deliberately saying, I am doing this for a certain period of time, I know I'm safe, and you're not in this like, I could die any second kind of thing.
You're not living in my house where my husband keeps the house freezing to death, and
yes.
I'm in like flannels in July.
And that's different because now you're just like wanting to yell at your husband.
Yeah.
So deliberate cold therapies or deliberate cold exposures, and there are different types. So you mentioned cold plunge, and I think cold plunge is the one that is the most common. It is probably the most accessible because you can buy these cold plunge tanks that apparently your phone has let you know can be kind of pricey.
Need them. Yeah, and they're expensive.
And
not all of them, I'm sure. But.
And then you fill it with water and ice. And so or just cold water. If you live in a cold area, you probably just put water in it. And if you leave it out in the winter up north, then it's going to be cold. So that's probably the one that's easiest. But also in deliberate cold exposures, you could just turn your shower to cold, or you could make a bathtub.
Have you ever done that?
Water.
I've done that because it's supposed to help your hair.
So, you did it for
vanity,
all the
of
health
course.
reasons.
Yeah. And I was like, I cannot do this. It's too cold.
Okay, so I love a hot shower, and I love not stressing myself in any way. But the more that I read about cold exposure and the major health benefits that you get from it, the more that I'm like, I'm going to do this. And so I started putting to cold for like the last
little
minute.
bit, yeah.
And I'll be like, Alexa, set a timer for a minute. And then I'm like, Alexa, has it really only been 10 seconds? And I don't normally make it for the minute. But you will rarely hear me start a sentence with the good things that come from menopause.
Yeah.
But one of the good things that came from menopause is I can tolerate that cold a lot better because I'm like running hot, and I'll be like, ooh, now's a good time to do my cold exposure. But yes, so you can get a cold plunge tank. You can just simply do a cold shower for a period of time. You can do cryotherapy. We have a cryotherapy at our wellness center. And so that's going to be cold air instead of cold water. I will say a lot of the research that I'm going to reference today to try to talk about what have we proven really comes from cold exposure is on the water, because it's easier to do those experiments. And remembering when we do research and we do experiments, we want to measure the water to a specific degree and then put a certain type of person in there and all of the things that you can control for. And so a lot of these experiments are just easier to control when you're doing them with cold. And I will say that, we'll talk about, when you're doing it with cold water, and we want to talk about what's available to people. So if you have available to you a cryotherapy chamber, and that's going to be a cold air exposure, cryotherapy chambers can be multiple different types. There's the ones that is just your neck down. And then there are the ones that are a whole body chamber. Remembering that a lot of different parts of your body respond to cold and help you thermoregulate differently. you're going to have a different effect depending on how much of yourself you get cold. So some of these things do vary. And so the research won't apply 100% to everything, but I think we can take these takeaway messages and it'll apply pretty safely to however you're doing your cold exposure. And some research was done just by people going out into the cold. So not bundled up, t-shirt and shorts, and stepping outside in the winter in Chicago and staying there for a minute. I feel that it's important for us to say that be safe, be smart, and if you're uncomfortably cold, then you're getting the therapeutic effect. You don't have to go how many degrees, and but if you are uncomfortably cold to a point to where it's painful, then you can
cause harm.
You can cause harm. You can freeze your skin. You can get hypothermic. These aren't things that happen real easy, but don't ignore your body too much. Make sure that you are.
When you said when it can be super harmful, which is, this has completely, you're probably like, where in the world is she about to go? But when I worked in the hospital, if someone had cardiac arrest, we would use cold therapy to cool their bodies. And so there's a lot of therapeutic effects. But we don't want you to get that far where we're having to use a cold blanket to revive you.
Right. And hyperthermia, there's very little room for error. When you start getting overheated, your body doesn't do great to bring that down, and you can start cooking stuff and it's bad. Hypothermia, when you're getting colder, there's lots of room there, and it takes a extended period of time and some pretty cold temperatures before there's serious damage done. So let's talk about what happens to your body when you have deliberate cold exposure.
I have to first get my mind right. I would say I got to get my mind right.
Okay, so that's huge, because one of the things that they are using cold exposure for is helping with mental toughness.
It would take a whole lot of mental toughness.
And so the Navy SEALs have been doing this. And of course, this is the Navy, and cold water makes sense on so many levels. But the Navy SEALs have been doing this, and there's so much research that they've done with Navy SEALs to talk about the mental toughness and how you can train your brain for this. So I do think for people who are working to overcome challenges, or people who are trying to create a mental toughness, teaching yourself that you can do something that feels uncomfortable, that after pain typically comes improvement, when it comes to working out, when it comes to things
no pain, no gain,
making yourself stronger. And so, of course, within reason and being smart about it. But one of the things that's recommended is not just should you do it, but how should you do it? And one of the things that you can get more out of your cold exposure is if you get into the cold exposure and you actually take yourself through, I can do this. You have mental mantras that are teaching you how much stronger you're becoming. So there's some mental toughness. So prepping for it, and then actually doing it. And then afterwards, giving yourself half a second to say, I did it. I can do hard things. There is something in this life. We're always parenting this way. There's something in this life for recognizing that you can do hard things. My parents used to tell me all the time, well, life's hard, honey. And I try to take it after lots of, I was going to say after lots of therapy, but it was actually after lots of classes in therapy. Like after I got a master's degree in counseling, I thought, that's really good to know, but I'm going to take it an extra step. Maybe it was the therapy that I need. Life's hard, but you can do hard. And so I do think that there's a bit to being able to do hard. And being able to focus in when times are hard. So so you'd have to mentally prep for it.
Get my brain right.
And I do think that it's a different type of experience for different people. Some people are naturally hot all the time, and this is not something that they have a lot of anxiety toward. Some people are cold all the time, and they do have some anxiety toward it. But there is research that shows that the people who are cold all the time can develop a cold tolerance by doing cold exposures. And so intentional cold exposures not only mentally help you know I can do cold, but they actually help you to thermoregulate and be less sensitive to cold.
Oh, Josh would like it if I could do that.
I needed this when I was living in Chicago. And so being able to tolerate the cold better, there are countries in the world that that prep for the coming season. So they run their houses a little hot before summer, and they run their houses a little cold before winter, so that they can then be prepared and more comfortable with. And so it helps with, small thing like that. But what's actually going on in your body when you deliberately make yourself cold? One of the things that I think is super interesting is the amount that it increases your fight or flight hormones and neurotransmitters. So epinephrine, norepinephrine, and dopamine are all important things that we talk about. And epinephrine and norepinephrine are what are released in the fight or flight situation. We do not put ourselves in fight or flight very often. We're not uncomfortable very much. We sit in climate controlled buildings. We are, not running from a bear. And
we're not starved. Most of us are not starving.
Yes. And our body needs to cycle through these kind of, smaller fight or flight situations to be able to have our hormones cycle the way that they're supposed to. And norepinephrine and epinephrine increase your metabolism. No one's going, hey, time to not burn anything when you're running from a bear. That's when your metabolism kicks in and you really get that kind of euphoric lift. And so interestingly, different research has found that there is an immense increase in epinephrine and norepinephrine when you do cold therapy for even a short period of time, a minute. So a 500% increase in norepinephrine. And the research looked at norepinephrine levels prior to the cold therapy. There were different types of research, whether it was cold plunge or whether it was cryotherapy, how many minutes people stayed in. There was one research that put people in like 60-degree water for an hour. And I was like, well, that's a long time to be, and we're going to talk about optimal durations and things like that, but an hour is not. Yeah. But the research, so it's hard to apply that research beyond it. What if it was only 3 minutes? But all that being said, there were increases up to 500% higher in your norepinephrine. The norepinephrine and epinephrine are going to help you burn. They have an effect, so they're going to help your metabolism. They have an effect on your fat, and they help turn your nothing but storage white fat into more metabolically active brown fat.
I like that better too.
Yeah.
Personally, I think that's a good one.
So let's not exercise, but instead jump in a cold. Yeah, like if I can, I do not want to turn my shower to cold, but if I'm like, I didn't get up in time to exercise today, so let me do this instead. And not only does it increase your metabolism in that moment, but there are studies that show that it holds your metabolism elevated for up to hours later. So it depended on the study as to whether it was 1 hour, 3 hour, 5 hours. But it's very much like when you exercise, especially like there's a lot of research came out about HIIT therapy, the high impact, HIIT exercise, the high impact, high intensity.
Obviously, you were doing it. I mean,
yeah, exactly. I know exactly what it is. I study it. So the high intensity training, and you do this kind of move fast, get yourself and get yourself sweaty, and don't slow down. Move from circuit to circuit kind of stuff. And that became a really big deal, not only because of what you get from the training, but what you get after the training. And so the same idea here, that if it elevates your metabolism for up to 5 hours after, that's as if your body still thinks it's exercising, and you're burning more calories, and you're transitioning fat so that you're burning more fat. And the white fat, that is really a storage fat. Yeah. This is like, hey, we're here for if you need us for later. And then that can go to brown fat, which has more mitochondria in it. Mitochondria is so much more important for actually doing something. These are the
powerhouse
centers,
of the cells.
The powerhouse
That's
of the cell.
That's what I learned from biology.
That is exactly what the textbook would read. You got it. And so that's going to be fat that actually serves more of a purpose, and that you can burn that fat and use it for energy. And so when you up your norepinephrine levels, there is good research that supports that cold therapy will also help transition your not doing anything but sitting here creating a fatty layer into more productive fat that you'll burn. Yeah. So you're going to increase your metabolism, you're going to get rid of fat. Those are fabulous things for most Americans could use to increase their metabolism and get rid of fat. Yeah. This is good too for people who are starting exercise programs. And so they're doing a little bit of exercise. They want to see massive results because they've just started moving. And if you can throw some cryo as part of that, then you can increase your metabolism even more, get results faster, and stay more motivated because you're seeing
probably
things
hurt a
happen.
little less.
And absolutely hurt a little less, because one of the other things that we know icing does, the obvious solution here, we see all the athletes, the pro athletes.
I've been doing a lot of that in my house.
Yes. And so I talk about John Rett and his injuries.
Well, my daughter
and
too.
The
She
cryo. And she's hurt her
sprained
ankle.
Her ankle. I got a call.
Lots of athletes.
Lots of
injuries.
And lots of injuries lately. I was like, we have 3 pairs of crutches at my house since February. It's been fun. So my son, who is 16, decided he was going to attempt to dunk in between classes, because that's what 16-year-old boys do. And went to dunk, and on the way up he said he felt a pop. And so I, being the great mother and medical provider that I am, was like, well, that stinks for you, and I'm going to need you to get up, and I'm sorry that you made a bad decision.
And if you have a parent who is a healthcare provider,
this is
you're okay is typically the response.
Yes,
You're okay.
You're fine. You're fine.
I've done sick people all day. You're not one.
You're not. Okay. You're fine. You can walk. But he could not lift his leg. He could walk. And so I had him evaluated, and he had essentially given himself an avulsion fracture of his hip. So he'd kind of pulled some stuff off that growth plate, which was
And this is
lovely.
where we say stretch. Please stretch, because, it's these...
Warm up matters.
Yeah. His muscle's tight, and he's a growing kid. And so his muscle is tight on his bone anyway. And he hasn't warmed up in any way, so his muscle's tight. So as soon as he overexerts, he's kind of yanked the muscle off the bone.
So it was 4 weeks recovery. So he was non-weight bearing for 4 weeks, and also is he's driving now. So then he wasn't able to drive,
and he was in the middle of sport, and he was
right in the middle of basketball.
Yeah,
and I'm the parent that you will still he still had to go to practice, which means I still had to take him, because we're those parents. You're committed, and you're going to crutch yourself right on into practice, and so.
So you started throwing him in the cryo chamber.
Yes, we started doing physical therapy along with cryo. And after 2 sessions of cryo, he's like, Mom, this is amazing. I can tell such a huge difference.
It's
in
so
the pain
interesting.
level.
What I've heard from people when they get into is they can almost feel the cold settle into the area of injury. It feels
I have to ask him.
more
He didn't say that specifically, but he was just after the first one, he was like, well, that was kind of cool. But after the second one that he came in subsequent days, he was like, Mom, I can really, really tell a difference.
And we're noticing this with people with chronic pain because there is general inflammation. Definite acute pain where you have an acute injury, and it can really go and help pull the inflammation out. And especially when you have teenagers who you try to get them to actually throw an ice pack on there for 30 minutes.
It falls in the floor.
And and then you're like, that ice pack on the floor is not doing you any good. But if you can do something like a cold plunge or a cryotherapy, 3 minutes is going to be therapeutic, and that helps. The other thing when we talk about inflammation and chronic pain is the dopamine release that people get from cold plunge. And this was so interesting to me, how much dopamine goes up. So we know dopamine is the pleasure center. Dopamine.
I call it the lovey-dovey.
Yeah,
I like lovey-dovey.
Everyone does. So you're going to end up getting an increase in dopamine when you have bad habits like smoking, drinking,
anything addictive.
Things. Yeah, dopamine is what goes off in your addiction center that says, "Ooh, that's good. We should do more of it." And then you do more of it to a bad point. And so we want dopamine. Dopamine is what makes us feel good, and it's what says do more of that. Dopamine goes up by 250% with cold exposure. And so when you're doing this deliberate cold exposure, you can really get a dopamine surge. They did research where they measured dopamine immediately coming out of the cold, and then for every 10 minutes, and they saw dopamine elevated up to 2 hours after, and it could have been longer. The research study I was looking at there stopped measuring at 2 hours. So it wasn't that they watched it till it dropped to nothing. The research study said, let's see if it's up to 2 hours, and it was still elevated up to 2 hours. People are using this. There are anecdotal accounts of people who are using this to help with addiction recovery.
It would make sense.
It makes sense because a lot of what people are chasing in addiction is their dopamine surge.
Yeah.
And so if they can find healthier ways, and we do this with Please Take Up Running, find other ways to get your endorphins released that aren't associated with your addiction or the thing that you're trying to give up. And so people who are quitting smoking, people who are giving up other bad habits, the dopamine release can help. We've also seen with people who are struggling to manage different stress levels and manage mental illness, and it's not as a substitute for your other things, but I often say to people, go to therapy and do the other things that are going to help you feel better faster. Take up running, take up meditation, take up cold plunge, take up cryotherapy, and get the dopamine levels up faster. So it was interesting that some of the dopamine levels would rise as much with cold therapy as they did with some medications. The problem is we can't create a substitute because the research hasn't been done like it has through pharmaceuticals, where we say, and the frequency should be this amount, and this pill's going to last for 24 hours, then you got to take this pill again. We don't know how to dose that or do other things. So it's not a substitute for, but it'd be a great addition to getting those dopamine levels up. We've talked about increasing metabolism, getting rid of fat cells, increasing your norepinephrine and epinephrine and dopamine. And some of the studies, super interesting, when we put our body into this kind of stress, and maybe it's because it's intentional stress, we increased epi, norepi, and dopamine, but we did not increase the bad stress hormones like cortisol.
Yeah.
So you could get the good stuff from your catecholamines without the bad. And that's huge. That makes a big difference for people. Other things that kind of help here is helping with mental focus. People have looked at when you get out of the cold exposure that you are more mentally sharp, you have better memory. They've asked people to do mental tasks, and people were more successful in their mental task after the cold plunge. Not sure if this is because of dopamine, not sure if it's because of the other catecholamines or what's causing it, but people had more mental focus. That kind of brings us to how to best do. So, as I was reading through this, I was really like, what are all the things? That's a lot. I'm convinced I want to lose weight. I want to have a better metabolism.
My memory needs to be better.
My memory needs to be better. I want my hormone levels. I want the good hormones where they should be. I will say I found no research to support this, and there's a lot of back and forth on testosterone and estrogen levels. However, dopamine is an important part of the whole cascade that creates testosterone and the whole cascade that creates estrogen. Dopamine will increase luteinizing hormone. Luteinizing hormone will increase the sex hormones of testosterone and estrogen. And so a lot of people are using cold therapy to increase testosterone or estrogen levels. This happens a lot in testosterone levels. People are even, there's the cold girdles that men are wearing that is like ice packs that you wear as an underwear around your groin. Found no research to support that. And so I do not think that people need to do that. Does not sound pleasant, but also no proof that it's therapeutic any more than just making yourself cold. So you could do the cold shower instead of doing the ice underwear.
Yeah, that sounds very uncomfortable.
Sounds like we're talking about all things uncomfortable, but that's
sounds
extreme.
Like it's legit made up.
Somebody's making some money off this.
Yeah.
But there is some good, all of that to say, there is some good physiology to believe that when we increase dopamine that much, we will increase downstream testosterone and estrogen. I will say anecdotally, my own personal experience, not a research study I've done, but my own personal experience in managing menopause symptoms has been much improved with doing regular cryo. And if I do cryotherapy 3 times a week, I will have fewer hot flashes at night and improved kind of irritability. And so the dopamine release to me,
and John's can you go
helping.
every day?
Yes. He will lock me in that cryo chamber if he can. And so a few things I think we create a compelling argument. The research creates a compelling argument for cold plunge and cryo. And this is why you're seeing so much about it. This is why everyone's talking about it, because there are a lot of great things it's doing.
I think too that as a society and as a nation, we are starting to see some of the things that are broken, and like, what are the therapeutic beneficial things that we can do that are not, like, we can do ourselves.
Yes.
You know, like, it's not putting off your health on someone else, or, hey, I need a pill for this. Like, we're starting to see kind of this rise, and there has been for many, many years, but this, I feel like it's just kind of gained more momentum about, like, what can we do that's therapeutic, that's not traditional medicine.
And because our lifestyle in the last 20 to 50 years has changed so dramatically, we need to do things to increase our epinephrine and norepinephrine. You know, people didn't have to cold plunge when they were farmers who walked to work and were in the heat, and they got lots of stress hormones released from exercise,
like actually
whether
working
they chose
hard.
exercise or not. You know, 50 years ago, people didn't go to the gym for this stuff. But now we actually need to create space to do that kind of activity and to up our hormone levels to get them regulated. Our life is taking down epi and norepi and dopamine, and we need to do things to add it back. There are some tips and tricks if you are a person who is doing a cold exposure, or if you are a person who's thinking about it. The recommendation is most research shows that it is most therapeutic at 11 minutes a week. You can do that in 2 settings depending on how cold. You know, some cold you don't want to be exposed for more than 3 or 4 minutes. Our cryo chamber here, the recommendation is a 3-minute exposure. And so that would be 3 to 4 times a week to try to get around that 11 minutes. And 11 minutes isn't, you know, it must be this or it's not therapeutic at all. It's just that that's sort of a target. So,
and you can work yourself up. Like, you don't have to like be like, oh my goodness, I'm going to stay in here for 3 minutes no matter what. Like, if you do a minute and then you're working yourself up, like that's still better than nothing.
And you're going to get some therapeutic effect, but when you get to about the 11 minutes a week will be when you get the most therapeutic effect. And working yourself up is a great idea. A couple of other tips and tricks. There's times of day that may impact. We believe that insomnia may be improved with cold exposure. And so we have a typical circadian temperature throughout the day. We're coldest a couple hours before we wake up. And then as it goes through the day, you get warmer, and then you start to drop off to cold in the evening, telling you it's time to go to sleep. And so if you're doing this to help with insomnia, it would be best to do it earlier in the day. That seems a little counterintuitive, but when you get out of cold, then your body works hard to heat you up. That's part of the metabolism. So you're having thermogenesis for the hours after, and you might not want to create that thermogenesis at night when your body is trying to cool you down to go to sleep. But a lot of people will say regular cryotherapy helps with insomnia and sleep issues as well. Again, maybe not your number one and only solution, but definite help. A number of places, us included, have sauna and cryo. And so people wonder, should I do sauna first? Should I do cryo first? You can't get into a cryo chamber if you are real sweaty, because things will freeze and it can cause skin damage. And so you got to make sure you dry off all the sweat. So, you know, don't get out of the sauna and jump straight into the, get a little bit temperature regulated, get back down to room temperature, get rid of all the sweat. But if you want the best therapeutic benefit from the cryo, do the sauna first, because you want your body to naturally create that thermogenesis and heat yourself back up to get the best metabolism improvement. If you help your body heat up by wrapping in a bunch of blankets, jumping into a sauna, then your body hasn't had to do as much work. So making sure that you do sauna then cryo will give you a little bit better therapeutic benefit. I think if you're interested at all in trying this, if you do it safe and you listen to your body, there is really no harm in trying to turn your shower to cold for the last minute, and try that, you know, a few times a week. There is no harm in trying to jump into the cryo and see how you do with it. Start with a minute. See if the experience benefits you. I will say my personal experience in our cryo chamber is when I get out, I feel like I can rule the world. Yeah. I mean, I kind of already think I rule the world, but I really...
It just gives you the additional nudge you need.
It does, to like, bring it on, world, I'm ready. So I personally like to do it in the morning because I'm not a morning person. And so if I get to work and I do that first, it really puts, the dopamine comes up and it puts me ready for the day. In all of the research that we have done in seeing if this is something we wanted to offer our patients, and the research I was looking at again in this preparing for this podcast, there are some great benefits from cold exposure. So however is right for you, I would highly recommend that you try it. We like to leave you on a good note, so today's Tell Me Something Good is best friends. I just can't say enough about the people who you don't have to talk to every day and you can always pick up right where you left off. The people who know you many times better than you know yourself. They tell you what you need to hear, even sometimes when it's hard to hear. They make you better. There is nothing better than best friends. I've been so blessed to have so many best friends throughout my life, some of which I've known since kindergarten, and it is truly something good. Thank you for joining us today, and until next time, take care of yourself.